It's a 7 a.m., and usually the West Highland White Terrier living in this house is just stationed at the front door. I mean, practically vibrating with excitement, entirely ready to conquer the neighborhood before the leash even comes off the coat hook.
Oh, yeah, the absolute classic terrier morning protocol.
Mhm.
Just high energy, zero hesitation.
Exactly. But today, the routine fractures just a little bit. She walks out of the bedroom, but then she pauses on the living room rug for a few extra seconds before finally making her way to the door.
Which is nothing dramatic, right?
Right. She still goes on the walk, she still inhales her breakfast, but later that day, you notice she's licking her front paws just a bit more intensely than usual. And out on the afternoon walk, she pulls up short near a favorite overgrown hedge she usually loves to terrorize, gives her flank a quick scratch, and she just moves on.
And right there, nestled in those tiny deviations, is the core mission of our deep dive today.
Yeah, because individually, every single one of those moments is totally forgettable.
Exactly.
Yeah.
Little extra paw licking, one shorter pause, a bypassed hedge. But together, over the course of 12 hours, they form a distinct behavioral pattern.
Right.
Protecting a Westie's health, or really any stoic breed's health, starts with knowing your individual dog well enough to recognize when that pattern fundamentally shifts.
So what does this all mean? Like, why are we focusing so hyper-specifically on these tiny, subtle clues?
Well, it comes down to the unique historical challenge of this specific breed. You are dealing with a courageous, persistent little earth dog that was bred to hunt in harsh conditions.
Right, they're tough.
Super tough. A terrier does not just stop eating or stop playing or stop shadowing you around the house the second a joint aches or their stomach cramps.
Yeah.
They push through the pain because that is exactly how they're wired.
So as an owner, you have to learn how to see past that natural grit.
You really do. You cannot sit around waiting for one massive, dramatic symptom to announce itself. You have to look at the whole picture.
Okay, so to decode that picture, we're going to start our analysis on the very outside, right? The dog's iconic appearance. Because what is most visible to you is often what gets the most misunderstood.
Yes, we definitely have to talk about the disguise of that famous white coat. Because skin issues are a massive, dominant topic for this breed.
They really dominate veterinary visits for Westies.
For sure. And I want to anchor our discussion on one specific word right out of the gate, which is persistent.
Persistent. Oh,
Right, because an occasional scratch behind the ear is completely normal mammalian behavior. What you are looking for is recurring, obsessive paw licking or chewing.
like redness between the toes.
Right, exactly. Redness, rust-colored saliva staining on that white fur, maybe a sudden musky odor, hair loss, darkened skin patches, scabs, or repeated bacterial infections.
Basically, those are not just inconvenient grooming flaws. They are structural health failures.
Yes.
Okay, let's unpack this for a second. Because if my dog is constantly itchy, my first instinct, and I think the instinct of almost every owner, is to blame the food.
Oh, absolutely.
I mean, I'm going to run to the pet store, scrutinize the ingredient list, and swap her kibble for something grain-free or salmon-based. Isn't that the obvious, immediate fix?
It is the most common assumption, but changing the food is often trying to fix a plumbing issue by replacing the roof.
Oh, okay.
You have to understand the mechanism of a dog's skin. Think of a healthy skin barrier, like a solid brick wall. The skin cells are the bricks, and the natural oils and lipids are the mortar holding it all tightly together.
Okay, I'm with you.
Well, in a lot of allergy-prone Westies, that mortar is genetically crumbly. It's defective.
So the wall is essentially leaky?
Exactly. Microscopic gaps open up, moisture escapes, drying the skin out, and environmental allergens like pollen, dust mites, grass, they slip right through those gaps and set off massive alarm bells in the immune system.
Oh, wow.
And that triggers the systemic itch. So if the wall itself is structurally failing, changing their protein from chicken to lamb doesn't do a single thing to patch the holes.
Right, because the pollen is still getting in.
Right. You also have to rule out parasites, yeast infections, contact irritation, moisture trapped under a thick coat, or even harsh reactions to the grooming products you're actually using.
Which means if I am constantly switching their food and then throwing in like an over-the-counter oatmeal shampoo and then adding a trendy new skin supplement all in the same 2-week window, I'm not actually solving it.
You're just throwing data into a blender.
Yeah.
If you change 5 variables at once and the dog's itching stops or gets radically worse, you have absolutely no idea which of those changes caused the result.
You're just guessing.
Totally guessing.
Yeah.
It makes the diagnostic pattern incredibly hard for your vet to read. What actually works is addressing the skin barrier medically.
Which means what, exactly?
That means cytology testing to check for yeast or bacteria, and sometimes running a genuinely controlled, strict dietary trial using prescription hydrolyzed protein under a vet supervision. You have to isolate the variables, not just guess your way through different bags of boutique kibble.
That makes profound sense. It's about isolation and observation. And since we are already talking about that fluffy white coat, we really need to address what else it hides, because that coat is essentially an optical illusion.
Oh, it completely masks the dog's physical frame. It is a phenomenal disguise for weight gain.
And even a modest weight gain is a critical failure for this breed. We are talking about a very compact, sturdy, but ultimately small frame.
Yeah, if a 15-pound dog gains 3 pounds, that is a 20% increase in their total body mass.
Which, I mean, that would be like a 150-pound human suddenly carrying around a 30-pound backpack all day, every day.
And that extra weight puts immediate grinding stress on their joints. It compresses their airway and affects their breathing mechanics, and it dramatically lowers their heat tolerance.
Because fat is an insulator.
Exactly. And conversely, unexplained weight loss or muscle wasting is an equally major red flag. You cannot just trust your eyes when looking at a fluffy dog.
You have to get in there.
Hands-on, tactile physical checks are mandatory. You have to physically get your fingers under that coat to feel their ribs and trace their spine to know what is actually happening underneath the illusion.
So if the coat is hiding red, inflamed skin and fluctuating weight, we really have to ask what else is flying under the radar here, moving from the body to the head, specifically the ears, eyes, and teeth.
The silent sufferers.
Right. These areas are where owners chronically misinterpret signs of pain, mostly because the dog's daily routines remain stubbornly unchanged.
Yes. Ear infections, for instance, are deeply connected to that leaky skin barrier we just discussed. I mean, the ear canal is just specialized skin.
Right, so we are watching for head shaking, violent scratching at the ears, redness, that awful yeasty odor, or, the dog leaning away when you try to pet their head. But there is a huge temptation here to just hop online and buy endless DIY flushes and treatments for recurring ear issues.
Which is such a dangerous diagnostic trap. Recurring ear infections demand real veterinary digging. Because if it keeps coming back, the underlying mechanism, the crumbling brick wall, isn't being addressed. You are just treating the symptom, not the disease.
And worse, chronic inflammation narrows the ear canal permanently over time, eventually requiring surgery.
Exactly.
I always think of this analogy like aggressive, overly frequent ear cleaning at home is basically like scrubbing a bad sunburn with a coarse towel.
Oh, that's perfectly put. And eventually that tissue just breaks down. The skin inside an infected ear is already macerated and hypersensitive.
Right.
Forcing harsh liquids in there constantly just creates more trauma. Gentle and medically appropriate is always, always better than frequent and forceful.
We see a similar stoicism with their eyes, too. The signs can be really subtle, like a bit of squinting, some extra tear staining, face rubbing against the carpet, or a sudden sensitivity to bright sunlight.
Yeah, but there's one behavioral shift that really stands out.
Which is,
A dog that suddenly seems slightly less confident navigating a familiar space, like hesitating for just a second before jumping onto the couch they've conquered 1,000 times.
and what's fascinating here is how frequently owners write off cloudy eyes or those slight vision hesitations as, simple aging.
Right, they assume it's just a natural slowing down, but sudden eye pain or a rapid change in the appearance of the eye needs prompt attention. The mechanics of the canine eye are incredibly delicate.
So rapid changes could indicate spikes in internal eye pressure, like glaucoma.
Exactly, or severe internal inflammation. And glaucoma is intensely painful. It's like a severe migraine in the eye. It is not something you take a wait-and-see approach with.
Okay, let's move down to the mouth. Actually, wait, hold on. I have to raise a point of extreme skepticism here.
Okay, go for it.
If I have a severe toothache, I am not touching a steak. I'm drinking soup. Are you telling me a Westie will just happily crunch down on hard kibble even if their mouth is in absolute agony?
I'm telling you they absolutely will.
Wait, really?
Yes. This is the great eating myth in veterinary medicine. A stoic terrier will eat through real, severe dental pain. Remember that grit we talked about?
Right, they push through.
The drive for sustenance completely overrides the localized pain in their mouth. They will simply swallow the pain. So an owner saying, well, she's still eating fine, does not automatically mean her mouth is healthy.
Wow, so they just power through it. What physical mechanics should we actually be looking for then if the food bowl isn't empty?
You have to watch the mechanics of how they eat and play. Are they picking up kibble and dropping it out of the side of their mouth? Are they suddenly shifting all their food to chew exclusively on one side of their jaw?
Okay, that makes sense.
Or are they totally ignoring a hard nylon chew toy they used to obsess over? You also watch for pawing at the mouth, bleeding gums, facial swelling under the eye, or becoming intensely head shy.
And this is vital. Persistent bad breath is not just a joke about dog breath. It is a clinical sign of active bacterial rot and tissue decay.
Yes, absolutely.
So, if we accept the reality that a Westie will eat through mouth pain, it logically follows that they will run through body pain. This brings us to their mechanics and internal engine, mobility, breathing, and digestion.
Mobility is where owners often let their dogs down the most.
I have a serious bone to pick with what I call small dog syndrome.
Well, let's hear it.
Treating a small dog's limp by just picking them up and carrying them everywhere is exactly like turning off your car's check engine light by putting a piece of black tape over the dashboard. Just because a dog is small and easy to scoop up doesn't mean a fundamental shift in their gait doesn't matter.
And eventually, that engine blows. When you carry a limping small dog, you are actively masking a structural failure. A biomechanical problem is a biomechanical problem, regardless of whether the dog weighs 15 pounds or 80 pounds.
Right.
And the clues that something is failing can be incredibly subtle. We are often looking for an intermittent skipping motion on one hind leg.
Why skipping specifically? Like, what is happening mechanically in the leg?
Well, small breeds are highly prone to a condition called patellar luxation, meaning the groove in their thigh bone that holds the kneecap is just too shallow.
Oh, so the kneecap literally slips out of its track.
Exactly. When that happens, the leg locks up. The dog skips a step or kicks the leg out backward to pop the kneecap back into the groove, and then they just keep running. It happens in an instant.
Wow.
It is not a certainty for every Westie, but it is highly common. You also want to watch for stiffness after resting, hesitating at the bottom of a flight of stairs, a reluctance to jump into the car, or a generally shorter, choppy stride.
Or even sitting with one leg kicked out in an unusual asymmetrical posture, right?
Yes, and it's not just the knees. Hips, spinal discs, muscle strains, and even toe arthritis could be the culprits.
Which means any persistent limping or skipping needs a real veterinary workup. Now, moving up to the chest, breathing,
Wow.
coughing, noisy breathing, tiring quickly on walks, or even fainting. I feel like sometimes people see a terrier panting hard and just brush it off as, oh, they saw a squirrel, they're just worked up.
Cool.
Typical terrier intensity.
And that is a dangerous assumption that costs crucial diagnostic time. The respiratory system is literally the internal engine cooling and oxygenating the body.
Right.
If your car's engine starts making a weird rattling noise, you check it. You should never dismiss persistent panting, coughing, or sudden exhaustion as just excitement, heat, or age without thoroughly investigating it. Westies can be prone to specific lung conditions like pulmonary fibrosis, which stiffens the lungs over time.
And the absolute best way to help your vet figure out what's going on is to capture the event on video.
Oh, 100%.
If your dog is having a weird breathing episode, whether it's honking while pulling on the leash, coughing during sleep, or struggling after exercise, getting your phone out and recording it is pure gold for a vet. It captures the exact mechanism, the sound, and the environmental context, which they almost never recreate perfectly in the sterile clinic environment.
Video evidence is invaluable. Now let's trace that system down to the fuel line, digestion.
Okay, so we are watching for the classic signs. Persistent vomiting, diarrhea, constipation, excessive gas, signs of abdominal discomfort where they stretch out in a prayer position, dramatic appetite changes, or finding blood and mucus in the stool.
The operative word here, once again, is persistent.
Right.
One isolated, mild episode of a loose stool in an otherwise completely energetic, bright, normal dog, that might warrant a brief watch and wait approach for 12 hours. But anything persistent, anything severe, or anything paired with systemic symptoms like profound lethargy, that is an immediate vet call.
And it goes without saying, if you have even a remote suspicion of toxins, like they chewed a toxic houseplant or you dropped a human medication on the floor, that is an immediate call to the vet or animal poison control. You do not wait to see if they get sick.
Absolutely not. You don't wait on toxins.
So we've covered the visible mechanics, joints, breathing, digestion, but the most confusing issues for owners usually happen deep in the internal systems, specifically the liver.
Right, the liver is the body's primary filtration plant.
And here's where it gets really interesting, because if you spend more than 5 minutes on a Westie owner forum or a Facebook group, you are going to see terrified posts about copper-related liver conditions. It is a known genetic issue in the breed.
It is, yeah.
So shouldn't every single owner march into their clinic and demand advanced liver biopsies and specialized testing immediately just to be safe?
If we connect this to the bigger picture, I am going to firmly but calmly advise against that level of panic.
Okay, why is that?
Because overtesting without clinical cause often leads to unnecessary anxiety, massive vet bills, and highly invasive procedures for the dog. Think of the liver like a filtration plant, right?
Right.
In some Westies, there is a genetic glitch where the plant accidentally hoards copper from their diet instead of flushing it out into the bile.
Oh.
Over time, that hoarded copper becomes toxic to the liver cells. But, and this is crucial, not every Westie has this glitch, not by a long shot.
So buying a Westie doesn't guarantee a liver problem.
Absolutely not. And one random symptom, like a single bout of vomiting, does not confirm it. Diagnosing this requires a relevant family history, specific clinical signs, and elevated blood markers, meaning routine blood work shows liver enzymes are spiking, indicating the filter is clogged.
So the goal here isn't to diagnose your dog prematurely.
Exactly. The goal is simply being informed. You want to know this genetic quirk exists so that if routine blood work shows an anomaly, you can have a smart, measured conversation with your vet about whether copper might be the culprit.
That is a huge relief. Be informed, be vigilant, but don't be panicked. Now, what about the neurological system? These signs might be less common day to day, but from my understanding, they are absolutely non-negotiable.
Completely non-negotiable. We are talking about profound weakness, a sudden loss of coordination like they're drunk, dragging a foot so the nails scrape the pavement, tremors, active seizures, walking in compulsive circles, a severe head tilt, sudden unexplainable confusion in the house, or a total inability to stand up.
There is zero wait and see with those, right? You aren't seeing if they sleep it off.
Zero. The central nervous system does not operate like a mild stomach bug. It does not resolve itself with rest. These signs require professional neurological evaluation immediately.
Okay, we have covered a massive amount of physiology. Skin barriers, eye pressure, masked dental pain, luxating patellas, and liver filtration. As an owner, you now have a highly detailed map of potential system failures. But how do you synthesize all this observational data without becoming completely overly anxious every time your dog blinks?
You need a plan.
We need to build a practical action plan. And the best place to start that action plan is with this single most common source of owner panic: finding lumps.
Oh, absolutely. You are petting your dog on the couch, your fingers graze a bump under the skin, and your heart immediately drops into your stomach. Cancer is the first thought.
Which is an entirely understandable human reaction.
Of course, but I want to reassure you, a vast majority of these lumps in older dogs are completely benign. They are often fatty lipomas, just collections of fat cells or harmless sebaceous cysts. However, every new lump always needs to be medically checked.
And you want to track the data objectively. Like, where exactly is it located? What is the size? Is the texture soft and squishy or hard and fixed? Is it painful when touched? Is the dog obsessively licking it? And crucially, is it changing rapidly over a few weeks?
Taking photos with a small ruler or even just a coin next to it for scale is a brilliant way to track growth objectively, so you aren't relying on memory.
But here's the critical instruction, and I can't stress this enough. Do not repeatedly squeeze, poke, or try to pop lumps at home.
Oh, definitely not.
If it is a cyst, squeezing it can rupture the sac internally under the skin, spilling that material into the tissue and causing a massive, painful, inflammatory response. Leave the poking to the professionals.
Very sound advice. Now, if we take everything we've discussed, the hidden pain, the internal mechanics, the skin, we can connect it all to one overarching, universally visible signal, which is behavior.
This might be the most important takeaway of the entire deep dive.
It really is. A new onset of irritability, hiding under the bed, resisting being brushed, restless pacing at night, or a previously perfectly trained dog suddenly house soiling. Owners almost universally write this off as the dog just being stubborn, spiteful, or going through a grumpy senior phase.
Yeah.
But behavior is a health signal. Often, these behavioral shifts point directly to physical pain.
They literally cannot speak English to tell you their lower back is throbbing, so they just snap their teeth when you reach down to pick them up.
Yes, and that snap is their way of communicating, I'm physically vulnerable right now, please do not touch me, it hurts.
Yeah.
It is a protective mechanism, not a discipline problem.
So let's break down exactly when you should take action based on all these signs. We have categorized this into 3 tiers of care. Tier 1,
Yep.
the next scheduled visit. What falls into this bucket?
These are your chronic, low-grade, highly stable issues. Recurring mild itching that isn't breaking the skin, gradual changes in the coat's texture, chronic but mild paw licking, the slow buildup of dental tartar over months, gradual weight gain, or a small lump that the vet has already checked and remains totally unchanged in size.
Just document them and mention them at your next routine checkup.
Exactly.
Okay, tier 2, the prompt call to the vet. You aren't rushing out the door to the 24-hour emergency room at 2 a.m., but you are absolutely calling your primary clinic the second they open in the morning.
Correct. This tier is for acute, distressing symptoms. Persistent vomiting or diarrhea that lasts more than a day, a real drop in appetite, new or repeated limping, rapid and unexplained weight loss, sudden eye redness or squinting, rapidly worsening skin infections, persistent coughing, marked lethargy where they won't engage, or real, sudden behavioral shifts like aggression or hiding.
And finally, tier 3, immediate emergency. Drop everything you are doing, put the dog in the car.
Severe breathing difficulty or gasping, sudden collapse. Check the gums if they are pale white, blue, or muddy gray instead of bubblegum pink. That is an oxygen emergency.
Scary.
Very. Uncontrolled bleeding, any suspected poisoning, repeated or prolonged seizures, sudden paralysis of the back legs, severe abdominal pain where the belly is rigid and swollen, or any severe traumatic eye injury.
That is a fantastic, incredibly clear triage framework. And to help manage all these observations without losing your mind, you need a system. Keep simple, dated records. Jot down when a symptom starts, the frequency, whether it happens in a specific season, and what exact foods or supplements they are currently eating. You can actually use the Vital Pet app to organize all this info chronologically right on your phone. We'll drop a link to that in the description.
Clean documentation is your vet's absolute best friend. It gives them the actual pattern instead of relying on an owner's stressed memory during an exam.
Let's loop all the way back to the morning scene from our introduction. You know, the Westie pausing on the rug, the paw licking, the bypassed hedge.
Well, in our scenario, the owner didn't write off that paw licking and hedge avoidance as just a fluke or a stubborn terrier moment. She understood the established pattern.
Right.
She checked the paws, she took a quick video of the dog limping slightly away from the hedge, and she called the vet to discuss the shift in behavior.
Because she had internalized the 4 major misconceptions we just spent this entire deep dive destroying, let's summarize them to lock this knowledge in. Myth number 1. Every itchy Westie has a simple food allergy.
False. That is a massive oversimplification of a highly complex skin barrier and environmental immune response.
Myth number 2. The eating myth. A dog that is still playing and eating kibble can't possibly be in severe pain.
False. Their instinctual courage and grit will entirely mask severe dental rot or structural joint pain.
Myth number 3. Small dog syndrome. Being easy to carry means you don't need to seriously evaluate mobility issues.
False again. A gait change like skipping is a mechanical failure that requires medical attention, regardless of how easily you can scoop the dog up.
And myth number 4. The disguise. A beautiful, fluffy white coat guarantees healthy skin and a healthy weight underneath.
False. That coat is a beautiful illusion that absolutely requires hands-on, tactile investigation.
Now, as a quick reminder, this deep dive is for educational purposes. Always, always consult your local veterinarian if you are concerned about your dog's health.
The ultimate goal here isn't to make you paranoid about every breath your dog takes, but to make you observant. You act as the vital translation layer between your dog's silent grit and the medical care they actually need.
And that leaves us with one final, slightly provocative thought to carry with you. If generations of selective breeding can create a terrier so deeply courageous that it instinctually masks its own physical pain from the world, you have to wonder, is that stubborn, grumpy, or difficult behavior you've been so frustrated with and trying so hard to train out of your own pet actually just a hidden health issue they've been silently compensating for all along?